56% of us wish we can find a therapist or other behavioral health specialist for ourselves or someone we love. Most of us start the journey by asking our primary care physician for help, yet they are very busy and just as confused as we are by the lack of treatment options. Express Access solves that problem with healthcare's first scientific referral platform. In fact, many patients set appointments with a matched clinician in less time than many patients are kept on hold randomly seeking a clinician. Let's see how it works. All Dr. Smith needs to do is direct the patient to the flyer on the wall, or hand them a copy. Ideally, the doctor has the patient find a provider and schedule their first appointment while they're still in the doctor's office. The patient can access the mobile-friendly web application on their phone, tablet, or computer. The patient creates their own confidential and secure account. Based on the QR code, the patient is directed to their specific PCP landing page, where the patient selects their PCP. The patient answers a few questions about their insurance, location, and preferred treatment times. The patient then takes a full panel diagnostic screening called TOP, short for the Treatment Outcome Package, which was robustly developed by Factor, analyzing nearly every diagnostic symptom on millions of the patients across all levels of care. It's powerful, yet short. If the patient's symptoms are appropriate for outpatient treatment, the patient is given a list of 40 clinicians in their area that take their insurance and are ideally proven to be exceptional in helping the patients with similar issues in the recent past. We focus the patient's attention on the only 3 pieces of information that matter: matching grade, estimated wait time, and how responsive the provider is within the marketplace. The patient can filter on any issue that matters to them, like in-person care versus virtual, or male versus female, and/or review the provider's bio and treatment information. The patient then adds their preferred or favorite providers to their list. The more, the better. If they have selected a provider with direct scheduling, they can find and book the appointment time here, or wait for providers to offer an appointment time, which they can accept or reject. At the end of this entire process, that often takes just 15 minutes, the patient is directed to the provider's preferred intake finalization process, calling a phone number or directed to a web page to complete pre-appointment intake paperwork. Behavioral health providers and intake staff log into their dashboard and click their waitlist. Here, they see all clients who are in the intake and waitlist process. Here, we see Jane, who just added Mr. Jones to her favorites list. The intake staff can see all the details about the patient, including their insurance card information and time of day preference, and can offer an appointment time that works for both. This immediately triggers a text or email notice to Jane saying she has an appointment offer. Back on the intake dashboard, we see Jane move from waiting to having been offered an appointment to accepting an appointment. This simple process saves that average intake worker more than 10 minutes in playing phone tag. Finally, the PCP, on their own dashboard, can confirm his patient has scheduled an appointment and track outcomes.